All right, I think everybody is in the call. One last reminder for those that just joined, please record this on your own if you would like a video or audio copy, just so that I can ensure you have this by your deadline. Otherwise, the only way I'll be able to get this to you is via Google Drive. So please record on your own if you can, and please submit your questions in the chat. We have had a lot of requests concerning capacity issues due to COVID at our CHI Health hospitals. And Dr. Cary Ward is the Chief Medical Officer for CHI Health. He oversees all 14 of our hospitals, and he's here to address capacity. So Dr. Ward, we'll go ahead and get started here. And first, just answer the question that I think a lot of people have today. Are we full at our hospital?
Yeah, I'm happy to say hi, everybody. I'm Cary Ward. I'm the Chief Medical Officer here, and I'm happy to say we're not full. We have capacity, and we're certainly not overwhelmed, though we've seen a growth in the number of COVID patients. We're not overwhelmed at this time.
You mentioned that we have seen an uptick. Can you talk about that a little bit more? I think that was a question that some other people had as well.
Yeah, the exact numbers today, we follow these numbers every day, of course, and we're right at 32 patients today across all of our 14 hospitals. And for most of our hospitals, that's 3 or less patients per hospital. A couple of them, our larger hospitals, have as many as 8 patients in them. So we're not, comparing this to the peak where we had hundreds of patients, over 200 patients. Our numbers are certainly in control at the time, and they are more than they were. At one point, we had as low as 14 patients several weeks ago. So we've grown, but even over the last week, our numbers have been relatively stable. But we're certainly encouraging everybody we can to get the vaccine now. We know how safe it is. We know how effective it is. And that's going to be the best way for all of us to keep from growing anymore.
A couple questions that are similar, so I'll try to kind of pair them together. Are we seeing any trends in those who are hospitalized, or do we know how many of those patients are vaccinated?
Yes, this is a report that we've started asking for regularly when our division incident command team meets all the time to discuss this. I don't have the exact numbers, but what we do know is the same with us across the state is these are almost all unvaccinated patients. This is clearly a problem now with those that are unvaccinated. The vaccine is remarkably effective. It's astounding how all of these patients tend to be unvaccinated and younger. As far as otherwise necessarily being sicker or any other big differences between them, I can't say that there's a clear difference.
What were you seeing at this time last year? Can you make a comparison to where we're at now versus last year?
Yeah, I think we were just talking about this. We had well over 100 patients in the hospital, and similarly, certainly patients that have other illnesses are more prone to developing a more severe disease, and people who are older are more likely to develop more severe disease. But again, these patients are younger. And I want to make it clear to those of you who are on the fence about this, we are seeing people in their 20s, 30s, and 40s who are healthy people prior to this, seriously ill, such that they require hospitalization from this disease. We did not see that as much before, but we are not seeing the 60 and the 70-year-olds like we were before because they're vaccinated.
Why are you not at capacity, or why is CHI Health not at capacity and other hospital systems say they are?
Yeah, I want to stress that we all are having issues with nurse staffing. All of us want nurses. We are all actively recruiting for nurses. So we would have more capacity if we had more nurses. So we're limited. It changes from day to day, of course, as we discharge and admit patients. But we're not at anything like, when we had 200 patients, we were clearly at a crisis sort of proportion at that time. We're not at that. I think we're all, very anxious about what these numbers could become if people continue to not get vaccinated and continue to get ill. But at least at this point, just like prior to the recent increase, we have a a reasonable number of beds and availability for any patients who come in, whether you need any kind of procedure, any kind of illness, we have space for you.
How full, or I'm sorry, there was one before this one. Have any new therapeutic measures been developed that make treatment any easier or the symptoms less severe for the patient?
You know, for the most part, thanks to a lot of great studies that have been done, we feel very confident in the current treatment. We're all looking for better, but currently, you know, remdesivir, steroids, management of oxygen, and general management of the patient are still the standards that we treat patients. You know, antibody treatment for some, we've learned a lot from the original BAM that we used to use for antibodies. We now use combinations. So we've had some modifications, but for the most part, to my knowledge, and an infectious disease doctor might help out with some of this, but for the most part, to my knowledge, no great new revolutionary treatments that we're using.
How full are CHI Health hospitals with non-COVID patients at this point because of the backlog of deferred care from last year? Do you have less surge capacity today than you did last fall because you're doing things now like continuing to take care of elective surgeries?
That's a good question. I think that's been part of the challenges that many of our colleagues and even us at times have expressed. And to make it clear, we're not wide open. We are all working every day to make sure we're working harder than we ever were to make sure the patients are in the right place at the right time. So if we've got a patient that can be discharged and get to a nursing home or get home, you know, we want to get the patients in the right place to make sure we have capacity. And I think we're all trying to do a better job of making sure our patients are in the right place so that we've got beds available. But yeah, when this first started and we were all in the overwhelmed state and we had hundreds of patients hospitalized, our ED volumes were much lower. Our surgical volumes were much lower. And people were sadly not even coming to the hospital when they were having symptoms that they needed to come in for the emergency room, you know, chest pain and things like that. So now that life is back to normal to some extent, people are coming back. So our emergency rooms are almost back to their previous volumes. Surgeries are back to previous volumes. So we're in a much more busy state than we were when all this was going on. So even a small increase in COVID patients is a challenge. But, you know, when we have hundreds and hundreds of patients in the hospital every day for various other illnesses, 30 more patients, 3 patients at one hospital is certainly not an overwhelming number at this time, at least in our current state.
Can you describe the symptoms of the patients who are hospitalized? Are they different or worse from cases in the past?
You know, to my knowledge, the symptoms are pretty much the same. COVID, even though we have, you know, as we all know, multiple variants out there now, different degrees of contagiousness, and some reports that maybe more severe illness, the symptoms are pretty much the same. The symptoms are shortness of breath, you know, low oxygen levels, fatigue, fevers, you know, all the usual viral type syndromes that we've all been, you know, well informed of over this last year. So can't even say that, you know, fortunately the Delta variant right now is that we hear so much about. It's about 20% of the cases in Nebraska. And you know, the numbers are small enough that I don't think anybody can say it clearly causes a different type of disease than the other variants did or the original virus. The symptoms are pretty much the same from patient to patient.
Is CHI Health requiring that employees be vaccinated? And if not, is that under discussion?
Yeah, we're not requiring it at this point. Definitely under discussion. Almost all of the major healthcare systems around the country are actively discussing and seriously considering this. My impression is that about all of us feel that it's the right thing to do. It protects our patients, protects the community, protects our employees, and the vaccine, you know, different story maybe 3 or 4 months ago when we still did not have a lot of data. But now 340 million people have received a dose of the vaccine. And the side effects of this vaccine are profoundly low and probably lower than many vaccines that are our routine vaccines we get. That plus the fact that we're now seeing the patients, the dramatic difference in the amount of disease that we had, and those who are developing the disease are not vaccinated. So we know the vaccine is effective. We know that it is safe. And so it's time, I think, to treat this much like the influenza vaccine. All hospitals require influenza vaccination for their employees. And so I think that it's now become a very similar sort of decision. So we're likely going to be doing that, and we're probably going to all be doing that together. All of our healthcare systems across the state are talking about this together, and we'll all probably make a decision sometime within the next several months.
Okay, sorry, let me get caught up here on the questions. I've had a lot of new ones come in here. What is your message on vaccinations, especially as numbers plateau?
To not repeat myself, I know that there have been a lot of reasons why many folks have decided not to get the vaccine. I think there's clearly, people don't like being told what to do, number one. There's been some mistrust from some of the leaders who have pushed this. There's so much misinformation out there. I certainly understand how people feel about this, but I just want to emphasize, if you would all, look at the real data, the real experts, the people you trust. Go to your doctor, go to your family medicine doctor, go to your internist, go to people, your nurses, your pharmacists, people who look at this information all the time and who are staying out of the politics, and listen to what they have to say, that the vaccine is incredibly safe. I could understand, and I understand the reticence now, but when there were only 10 doses or 1,000 doses of the vaccine first given, I can understand. Let's wait and see. Let's make sure. A lot of people weren't going to be the ones to stand in line at first now. But now 340 million doses have been given. If there were any significant side effects of this vaccine, and I want to stress, yes, there are side effects. There are some extremely rare conditions that have occurred, but there's no comparison between that and the complications of getting the disease if you get the disease. So my message is the vaccine is safe, it is extremely effective, and it's a very different situation than we were in 2 months ago, and less of an argument now for not getting the vaccine. So please, for the good of the community, for the good of your family, for the good of your own health, get out and get the vaccine. You've heard stories of people who are in the hospital on the ventilator, profoundly short of breath, barely able to get enough air, begging for the vaccine. Well, it's too late at that point. The vaccine takes weeks to become effective. And if we get going now and everybody get out there and get their vaccine, within a few weeks, just a few weeks, you already are developing antibodies after the vaccine that can protect you from illness. So please talk to people you trust, avoid the misinformation, try to get away from the politics of all this, and make a good informed decision and get out and get the vaccine.
Statistically, we know the vaccine is highly effective, but some will have breakthrough cases. Are you seeing many of these results in hospitalization, or because of vaccinations, have those folks been able to fight this without hospitalization?
Yeah, what we know is, like you said, that there are people who can still get the illness without that have had the vaccine. We've clearly seen people that have tested positive, but what has been remarkable is how much less symptomatic they are. Many of them are completely asymptomatic or only have a minor illness, much like a cold or a mild flu. The serious illness in people who've had the vaccine, I just want to stress, is really rare. To be hospitalized, to be on a ventilator. Now, anywhere in America, certainly cases happen, but it is a very effective vaccine. None of us knew that it was going to be this effective, frankly. Even the influenza vaccine is only 60 to 70% effective, most experts say. We did not realize how good this was going to be. The vaccine really does work and prevent serious illness.
Does the change in the state's reporting of virus numbers and the shift to weekly updates make it harder to track COVID activity in the overall community, or do you rely more on CHI Health's internal data to track that? Or as a healthcare provider, do you have access to data on the virus numbers that the general public doesn't have?
Yeah, well, I know there's been a lot of encouragement for the Health and Human Services to start reporting more often. And certainly if they choose to do that, I went to those numbers every day. I enjoyed seeing the numbers. Being part of a large healthcare system, we take care of a very high percentage of the patients that are across the state anyway with this. So we have access to the numbers. We know exactly what the disease is acting like. We know how many patients are on ventilators. We know if they've had the vaccine or not. So those numbers aren't critical for us as an institution. But if HHS decides to do it, I think that's fine. But I want to stress that the governor and the state CMO HHS, they've done an amazing job through all this. And we've all come to trust their judgment on how they report their support of vaccination, their support of testing. They're well aware of these concerns. And I think when they feel it's in the best interest of the state, they will change their reporting. But right now, we have access to the numbers. We all know approximately what the numbers are any given day. Unfortunately, they're not changing dramatically day by day. We're keeping a close eye on it.
A follow-up to that question, do we track our own numbers?
Absolutely. Yeah, every day we get a report on our numbers in great detail.
Oh, let's see here. Sorry, my questions got bumped again. Why wait several months to decide whether to require vaccination for healthcare providers at hospitals in the state?
Yeah, that's a good question. As you know, many healthcare organizations have already chosen to do that. Many large organizations have done it. And, overall, it's gone well. We've heard of stories of employees who absolutely refuse, and it forces them to have to work somewhere else. We certainly would have exceptions for for employees who couldn't receive the vaccine. So it's a matter of working through the logistics. We're a large organization. We have 14 hospitals, and we're part of an organization that has 150 hospitals, and we all want to do this together also. So we're all working with Nebraska Medicine and Methodist and Bryan and everywhere across the state. Ideally, we would all go together on this, and I think we're close to doing it. Hopefully, I'm all for people making decisions without too much duress, and I'm hoping that by the time we get around to it, I'm hoping that people are seeing how society's taking a very different view about this, and they're going to go out and get the vaccine themselves. It's not going to be a big deal to mandate it, hopefully, because everybody will have already had it. Because we all know months ago the politicians were very divided on it. Companies were divided on it. Our country was. We're clearly seeing a change now that regardless of which party you belong to, everybody is speaking up about the benefits of this vaccine. Really hard to deny it now. So, that maybe one reason why is that we think people are going to get the vaccine anyway. People are getting wise and are understanding the importance of the vaccine.
A couple questions about masking. Should we be wearing masks again? And school's about to start. Not many Nebraska schools are not requiring masks, and kids under 12 can't get vaccinated. Is that an area of concern?
Yeah, the masks clearly help. The masks clearly have helped prevention of the disease. The way I know none of us, very few of us, if any, like mask mandates, and most of us don't like wearing masks at all. And I want to stress the way to avoid wearing masks and the way to avoid mask mandates is vaccination. Vaccination is far better than masks in many ways. So if we all get vaccinated, then we don't even have to have this discussion. The recommendations change daily, and I do have to defer to the experts at national CDC on guidance for when and where the best place is to wear masks. So, I think there are definite situations, and one I want to stress is in hospitals. We clearly have to. One is we have no choice. It is a government a requirement, but it's for a good reason too. Hospitals, you have to wear masks. So when you're visiting the hospital, please always keep a mask on, because for the reasons we discussed, even though you've been vaccinated, people can still get an infection completely asymptomatic and can still spread it. And the hospital setting is the last place we would want to have that happen. So, that's one example. Nursing homes, another example. Airports and airplanes are unlikely to change their policies anytime soon. So those places, it's very clear, masks are going to be around for a while. Other settings, the recommendations change daily, and not enough time to speak to all of those.
This one, it may be too early to tell, but if a decision is made to require employees to get vaccinated, is it more likely that they will have a choice of vaccination or resignation, or would they be given the choice to furlough until the end of the pandemic?
Oh, that's a challenging question. I think experience has shown that we don't have any clue when the end of this pandemic is going to be. A lot of experts think there is going to be, just like influenza, low-grade disease throughout the year and intermittent spikes that may or may not follow a pattern like influenza. So I would doubt, I'm not an HR expert, but I would doubt that would be an option. We're going to do everything we can to accommodate and work with employees, but the vaccine, it's so safe, and almost everyone can get the vaccine. Unlike some vaccines, it's a pretty straightforward products that are in it, and there's not allergies, there's not other significant reactions, except extremely rarely. So we're hoping that those sorts of options aren't going to have to come up. There's clearly going to be some people who absolutely will.
Oh, sorry, hang on, I got to mute somebody here. Sorry, go ahead, Dr. Ward.
Oh, I think I finished. There's
Okay.
always going to be some people who refuse to get it, and they may have to work in settings where it's not required.
Somebody hopped on late here, so we'll just go back to kind of what you started with before we wrap up here. What have you seen in terms of hospitalization numbers at CHI health facilities in Nebraska? Are numbers way up? Are you seeing patients ending up in the ICU and on ventilators, or are the patients skewing younger? Just kind of, you've touched on this, but if you could just reiterate for those who hopped on a little late. Okay.
Our numbers have gone up slightly, although over the last week, they've been relatively stable. Whereas we had, over 200 patients at one point, we have 32 in all of our 14 hospitals today. And the numbers, like I say, have been relatively stable. At our lowest point several weeks ago, we had 14 patients. So you could argue it's more than doubled, but the numbers are still relatively small. We know the numbers in the state are going up. And our numbers of patients on ventilators has been relatively stable also. We have a relatively small number of people that are critically ill, but I want to stress, as I said earlier, some of these patients are 30 years old, 20 years old, and they were healthy prior to becoming ill. And the vast majority of them are unvaccinated.
This is the last question we'll be able to get to. We have a hard stop. Are you worried about hospitals filling up again?
Yeah, great question. The fact is, I don't know. I don't know. I think, any patient that becomes ill now from COVID worries me. It absolutely breaks our hearts to see someone become critically ill on a ventilator in this day and age, where if they had had the vaccine, if they had not been victims of misinformation and they had not listened to the wrong people giving them bad advice, they would have had the vaccine and they wouldn't have been hospitalized. That worries me a great deal. Yeah, the thought of any young, old, anyone being hospitalized now for what is truly a preventable disease, that's very sad, and that does worry me. And exactly what the numbers will be, how large they'll be, only 50% of the state is vaccinated right now, and only 30% of some areas are. So that's certainly a lot of people. That is a lot of people that could become ill over time. I do think because we have the vaccination that we do have a fair amount of immunity. I personally don't worry so much that we're going to get the kind of numbers we had before. But yeah, I think that I would be less worried if I knew that everyone finally decided to start lining up to get the vaccine that has not made that decision yet. Or prior.
Okay, unfortunately, we have to wrap up. I tried to get to at least one question everyone submitted, so I apologize if we missed you this time, but thank you so much for joining us. Dr. Ward, thank you for your time. And if you, for some reason, need a copy of this or a recording of this, you just need to email me. But like I said, I'm going to have to send you a Google Drive link, and I can't promise it'll be by your deadline. So just get in touch with me if you need some help, and I'll be happy to assist. Have a good day, everybody.
Thank you all.